Each day used to bring tears for COVID triage nurse Melissa Miner Brown. The crying has stopped, but the stress remains. She hopes getting vaccinated will ensure she and her family don't get COVID-19 again and help eradicate the virus.
I want to be the one to take a stand for those communities and educate them on why it's important that we get this vaccine, because COVID-19, it doesn't discriminate, but it has hit our communities so hard. And we have to start to build that trust so that we can get back to living the lives we once lived.
In New York City, once the nation's COVID-19 epicenter, the vaccination rollout stalled just as it was revving up. Barring a significant delivery of vials, the city expects to run out of vaccines in a week. Supply and distribution issues continue to plague the country. Adding to the challenges, the CDC has released a report warning that vaccination efforts are critical to halting the spread of a more contagious variant of the coronavirus. It's been detected in 10 states and could lead to a spike in infections and deaths. President-elect Joe Biden plans to create a national vaccination program with community sites across the country. His goal is to get 100 million shots into the arms of Americans in his first 100 days and hire a public health workforce numbering 100,000 people. He will invoke the Defense Production Act to increase the manufacture of vaccines and personal protection equipment.
This will be one of the most challenging operational efforts ever undertaken by our country. But you have my word that we will manage the hell out of this operation. We need funding from Congress to make this happen.
As the United States approaches 400,000 coronavirus deaths, the Biden transition team announced, come next week, the Trump administration's Operation Warp Speed will be no more. The incoming president will be announcing a new name for the country's pandemic response program. Natasha, Ghoneim, Jazeera, Wilmington, Delaware.